The most common non-pain complaints include difficulty concentrating, short-term memory loss, headache, depressed mood, insomnia, unrefreshing sleep, fatigue, heaviness of the extremities, bloating, constipation, and diarrhea. I believe evidence is building for early, aggressive treatment of this disorder, so it is important for you to be confident in your ability to make the diagnosis. Many clinicians rule out all other illnesses before making a diagnosis. This leads to unnecessary testing and excludes many patients who could benefit from proper treatment, but have other common comorbid illnesses that may explain their symptoms. This list shows how common other illnesses are in patients with fibromyalgia and demonstrates the overlap in their symptoms. If you treat one of these illnesses, but don't question the patient about symptoms related to fibromyalgia, you are likely to get a suboptimal result. I'll give you an example. A 30-year-old female presents to me complaining of daily headaches with migraine features and neck pain. Other portions of the history and physical exam do not suggest any secondary causes of headache or significant cervical spine disease. At least 30% of the chronic migraine patients that I see have neck pain as well. If I leave it at that and don't specifically question widespread pain and other symptoms of fibromyalgia, then I'll miss a major opportunity to treat the patient properly from the first visit. A major breakthrough occurred in 1990 when the American College of Rheumatology developed fibromyalgia diagnostic criteria. The criteria were as follows: widespread pain above and below the waist, on the left and right sides of the body, and axial pain. The pain must have been present for at least 3 months duration, and the physical exam must show significant tenderness at 11 of 18 tender points. When comparing these criteria to the diagnosis by a committee of experts, the specificity was 81% and the sensitivity was 88%. Although this clearly was a major advance, the tender point exam was rarely performed in primary care and psychiatry clinics. Furthermore, physicians who were performing the tender point exams had difficulty determining how much pressure to use and how much tenderness was significant. The American College of Rheumatology criteria advised using 4 kilograms of pressure. For these and other reasons, the American College of Rheumatology fibromyalgia experts developed alternative criteria without the use of tender point examination. This was published recently and was the culmination of a large clinical trial. These new alternative fibromyalgia diagnostic criteria take into account widespread pain by the Widespread Pain Index and the non-painful symptoms of fibromyalgia by the Composite Symptom Severity Score.